We have Dr. Madhukar here with us to speak to us on age and professionalism, the link between the two. He's like all of us, or most of us, he is also a cricket enthusiast. He's a trained umpire from England. He is associated with, I think, Martha's Hospital and Manasa Hospital in Bangalore. Psychiatrist by profession. Psychiatry, when we look at that, we have a lot of words which are connected to psychiatry. Sanity, insanity, and you have responsibility, frustration, life and love, and wisdom and pain. We have given him age and professionalism to talk about. Sir, it's over to you.
Thank you very much.
Welcome you, sir.
Thank you very much. Thank you. Good evening to all of you. First of all, I would like to thank the organizers for giving me an opportunity to be here and spend an evening with you. And thank you very much for the nice cup of tea and the puliogre. Is that right? Or aulaki? Okay. Okay. When the topic was discussed, or the age and professionalism, I changed it slightly. Rather than restricting itself to only to the age, think about the other aspects which might affect our culture, which might be something specific to our culture, which could affect the professionalism in us. Now, I'm sure most of you would have either lived abroad or spent time with people who have been, and then seen what's the difference like. Now, I'll give a few examples about myself. I grew up very much in Jayanagar itself, and when as a medical student, I don't know how many of you have doctors in your families as such, but it's very different from engineering or other fields. When you enter the medical field, yes, you have to spend about 5.5 years, and by the time you finish, you're already old that way, okay, because you're literally in your books or spending time in the hospitals. What was striking to me when I did my graduation from Bellary Medical College was the connect or the lack of connect with our teachers. Now, medical field is very much a hierarchical field, wherein you have the professors, assistant professors, and the so on and so forth. And actually, the junior most person who enters the field and subsequently gets the training, we actually are most comfortable with our seniors, the immediate predecessors, or the people who 2 or 3 years with whom actually you learn a lot, okay, not the people who are actually meant to teach. For me, the first actual contact with the professionalism was when I went to Christian Medical College, where I started actually my psychiatry. What really was different from studying in a government college was being on time at 8 o'clock, everybody, whether the professor or the student whoever is on time there, and the way the patients are treated. I don't know, maybe had I not had that experience of going to CMC, probably I would have never taken up psychiatry. So that was the kind of impact it had on me. Then subsequently, of course, I looked into the psychiatry as a specialty, and yes, it impressed me to continue further. Now, when I left India, that was in 1994, spent about 9 years in the UK. I'm not going to bore you people with all what happened in the hospitals there, but certain things again which was very useful, or which we all experience, either the precision of the switch what we talk about, or the technology of the Germans and all that, but again the discipline of the English people. Whoever you are, what you do is very much there as part of a job description, as part of your requirement, what you are expected to do. Again, having done my post-graduation here in NIMHANS, if you work beyond your normal working hours, you are actually appreciated. For the first time, I experienced it where I think just about 5 minutes past 5 o'clock on a Friday evening, because it's a 5-day week there, a nurse asked, "It's 5 past 5, what are you doing in the hospital?" So you don't want, or you are not expected to be beyond a particular time. So what they want is that particular time, to that you are expected to be there and you are available. But beyond that time, it's not a question of appreciation, but questions are asked as to why you are there. I think that brings in sense of the responsibility and how we go about it. Now, with respect to India, I'll spend a few minutes before I get into the topic as such. We all know that our population has touched a billion. In fact, it's now 1.21 from, I think, the last census, and clearly the second most populous country in the world, and we are expected to overtake China pretty soon. I don't know whether we should be happy and celebrate it, but certainly there is a lot of cause for concern about the jobs, the competition with each other, and all that. Now, we all know that the lifespan also, the longevity, when we used to do our basic or undergraduation, we had our community medicine book, which used to talk about lifespan 57 years, 58 years. Now, in the last again 20 years, it's gone up. People are living into their 80s, even into 90s. Now, that's almost like every other family has a person, now, which we have to be happy about. But along with the age brings back problems which only an aging society or we'll come to that a little later, the problems with the old age. The other thing is with respect to the education. We know that literacy has grown probably about 70 or 72% of us are literates, which means we are able to read and write. And likewise, our population, the younger population is actually increasing. Now, again, it's ironical. We have a prime minister who is in his 80s and a president. I think he is also 78 or 79, I think. But our population, more than 50% of the people are actually 25, and above 65, the 65% of the population is actually under 35 age. So, the average age is about 27 or 28 years. So, we are actually a young country that way, but somehow we seem to prefer leaders who are much older, not just by 5 or 10 years, but clearly 50 or 60 years age. Again, we don't know, we don't have reasons as to why that happens. Now, when we talk about India, we know how diverse our country is, and clearly the color, the language, and probably the food habits, religion, we move from one state to the other. Already people are looking at you surprised, what do you eat? Do you eat in your hands, or maybe you eat more of rice? Lots of questions about the diversity. However, we still have few things which are common. I don't think that we are necessarily have to be proud about it, but unfortunately, it's some of the things which I think we were talking about it, whether in terms of our lack of punctuality in certain things, or the with respect to the emotionality. Now, that's something which is very important. Perhaps we are one of the most emotional people in our country. When something goes wrong, the ability to think, take one step back, being able to understand and how we respond. If a person dies in a hospital, you have the hospital being ransacked. Okay, not really thinking as to what was there a fault with the doctor, was there a fault with, and just recently one person died in somewhere in Nelamangala, and about many buses were torched and lots of other things happened. So that's something which again concerns us, and not necessarily restricted to Indians living here. I guess even when they go abroad, we carry it with us. And the discipline or the indiscipline, that's something, the Q system, maybe we are just never going to learn. Perhaps somebody has to enforce on us that this is the way you have to live, and maybe then we will start thinking about it. And of course, there are many issues with respect to dowry, child marriage and all that, although the child marriage has come down, but something that is very much there, and that cuts across the states and the religion and all that. When we talk about being a professional, so there is something in us which we have to, which is expected of us, and we are clearly with that special knowledge what we have. You are engineers, and you know very well what is expected of you and how you provide your service. And likewise, me as a doctor, what I have learned and how I exercise or use that particular skill for my, or for the means of a livelihood, or it could be in terms of providing a service. Now, when we talk again about being a professional, we talk about the individual, we talk about the organization, and then subsequently what are the problems which can happen if there is a mismatch. And we all know there is a nice advertisement, I'm sure all of you would have seen, monster.com. You all have seen that, a person who is either dancing and the flight and all that, lots of things. So if there is a problem there, and how it can have an effect on the individual as well as on the organization. Now, if there is a problem, just again digressing a little, when I joined psychiatry, first my parents asked, are you really sure you want to take up psychiatry? And it took some time, because like you all, probably I would have become an engineer too. I had joined for textile engineering, but again, parents were very, very keen for me to take up medical. Okay, I did it. Then after that psychiatry, when I had a tough time to convince them, it is a specialty in medicine, you can make a livelihood. They were not very convinced about it. So when I decided to come back also, I was not very sure. But what I saw that is in the last 10 years, Bangalore, there are a lot of other problems. And what we encounter, it may surprise you, when at least about 15 or 20 patients who I see in the mornings or in the afternoons, majority of them come not because of the serious problems, but because of either relationship difficulties at home or problems at work. Problems at work which could well be the stress of handling difficult situations, and the not being able to cope, plus the targets, the IT people, more and more people are seeking help, not being able to concentrate, and there are other things also which affects them in terms of their relationship, and many of them carry work home. I don't know how many of you do here. Is it common here, or you finish your work? So that's something again which is having an effect, and there are a lot of people. We all know now, Bangalore or the number of diabetics is growing up, and so is the hypertension. So the reason I'm talking about is, when there is a mismatch, it has an effect both on physical and the psychological health, and clearly it's something which cannot be neglected, because A healthy individual contributes a lot. He is able to look after himself, his family, as well as the organization. So, a number of things which has changed over a period of time. Probably we, a psychiatrist who would have worried about his livelihood about 20 years ago need not. So, we are quite assured about our, say, daily bread and butter. So, which it's a, every coin has two sides to it. So, yes, there are problems. At the same time, people are there who are able to address that also. So, coming back with respect to the problems or with respect to the individual itself. Now, what is one is noticing or has been reported is how adequately prepared are they for the jobs. Now, again, when I talk about it, I will stress more on the medical side of it, because this is something which with respect to the engineering, I am not qualified at all. Although I did have a brief stint in Indian Institute of Technology for about 2 years after my medicine. I was doing my PhD in biomedical engineering, and then for some reasons I thought psychiatry would be better, so changed. So, being adequately prepared for the job is something which is lacking. Now, one of the, again, the surveys talks about 75 or maybe even up to 80% of our people, the graduates, the technical or the general graduates, are not sufficiently prepared to take up a job, and that has been shown. And likewise in the medical too, if one passes not just MBBS, even MD or the MS, to tell you honestly, even I would not be so confident. So, you prefer to have that experience, you prefer to have that amount of working hours and the knowledge to gain that amount of confidence. So, that is something which is very, very useful to think about. Second is again, the time has gone where a person used to think, I have got a job, I am going to work till my retirement, 60 years or so. So, nowadays I see more and more young people, particularly the IT sector, for that matter even in the doctors also, you think about 5 years, 6 years, and then subsequently change for a better opportunity. Now, that comes along with, it has its own negatives too. However, the demands on the individual are pretty much. He has to adjust to, or he has to work with different people. Again, many years ago there were hardly few women who were working in offices, but nowadays you have to, it's almost like, I don't know, I don't see many here, but certainly at least in the medical, it's almost like 60-40, perhaps it will become very soon 50-52. So, we are not really trained to handle